As a community of Uvalde continues to mourn the loss of 19 children and 2 teachers, politicians are split on how to prevent these massacres going forward.
More questions are being raised about what happened in Uvalde.
And a lot of people are upset over the lack of action from police.
We are pretty scared. A lot of my classmates actually, whenever we're in classes, we think of escape routes sometimes in case that there's a shooter in the building. And it's not normal. Like, a student shouldn't have to do that, but a lot of us actually do, and we didn't realize until we started talking about it after Uvalde. My name is Natalia Gomez, and I'm 11th grader at Early College High School. The Uvalde shooting definitely did make us more aware of how our conditions are here. It was a big realization that we don't feel safe here.
I think, parents are nervous, students are nervous, teachers are nervous, school administrators are nervous. We're talking with our students about safety protocols. We're talking to them about the reasons why they have to wear IDs all the time, the reasons why they must follow the dress code, the reasons why they can't open the door for anybody who's trying to get into the building. So certainly we want to train the police and we want to fix our buildings and deal with all of those things that allow tragedies to happen in this way. But there's so much more that we can be doing with our students and with our teachers.
There is a real coordinated approach to the work that we do. Because we are part of the same team, we're really getting to interact quite a bit with situations that might come up. My understanding of the way it works in other districts is it's more siloed. We have social workers, we have officers, and there's not a lot of intersectionality.
It's a model that a lot of districts are considering at this point because of the recognition of the need for mental health services to preclude or prevent an incidence of violence on a campus. We train together, we develop policy together, and then we work in the field together. We make sure that the wraparound services that a student needs are met. And then also we make sure that in the event that it becomes a criminal matter, the officer is in the area in the vicinity to make sure nobody gets hurt or harmed. When an officer goes down a hallway with an active shooter, that officer is in fear for his own life or her own life. But the reality of it is that their training has built their confidence level to allow them to believe that they can handle the incident. And so that's really the purpose of training behind all of this. It's really that they need to train through the fear.
The officers are looking at it from a safety and security perspective, and also handing some of that over to us so that we can look at things from a mental and behavioral health perspective. Once that has been adequately addressed, then a social worker can come in and we can do some work with that student or with that family and figure out, is this the first time that this has happened? Is there something that's going on? Is there some extra help or support that's needed? What is the reason for this threat that was made? I can think of times when an officer has come to me and said, there's a student that has mentioned a concern that a peer may be self-harming, a peer may be experiencing suicidal ideation. And because that child trusts that officer, and the officer brings them to me as a social worker, I'm able to do some screening and some follow-up and to really assess where things are with that student.
This isn't a problem that's going to be solved just by law enforcement, just by mental health, just by school administration, just by gun control. I mean, there's no one single solution to this kind of tragedy. Being innovative, creative, and collaborative in developing solutions that are going to address all of the different components is really the only way that we're going to see true change in these areas.
I think that preventative method would work, especially if it's targeting like the source of the problem, but just sitting by and doing nothing doesn't help. So I think that the social workers do have an idea of how to help.